Arthritis involving the facet joint can cause low backache. There's something called HLA-B27 positive back pain or arthritis, seronegative arthritis. All these can cause low back pain. So seronegative arthritis means the blood test will be negative for arthritis, but the patient has arthritis. So, and it usually affects the low back. Then there are other conditions such as tumors or cancers involving the spinal cord or the vertebral column. So most of these cancers, they are not primary cancers that arise from the vertebral column or the spinal cord. Most of these cancers are cancers that spread from other organs. The most common organs include breast and prostate. So prostate cancer and breast cancer can spread to the spinal cord. The vertebrae. So it can also manifest as intense pain, especially at night. Then tuberculosis, infection of the spine or the vertebrae can cause low backache. The most common type that we see is tuberculosis. So the patient may have other symptoms such as fever, weight loss, night sweats, all these symptoms. If somebody has these symptoms along with low backache, definitely we should go for an MRI of the lower spine. Now, if you see the spine structure, you can see that the vertebrae are arranged in a certain alignment. So these vertebrae are stacked one over the other like this. So sometimes with age or due to trauma, the alignment can be disrupted. That is called, and this is called listhesis. So when it happens in elderly or due to degeneration, it's called spondylolisthesis. So listhesis is nothing but displacement or loss of alignment of the vertebrae. So this can be easily found out in an X-ray, but other cases such as disc problems or the cancers involving the spinal cord or infections, all these will require MRI. There are some other conditions that can cause low backache, which are not related to the spine or the vertebrae. They could be like conditions that arise from the abdomen. The most common type is ureteric colic, whereby there is a kidney stone or a ureteric stone, which can cause radiating pain from the back to the groin. Sometimes pancreatic masses or pancreatic pathologies can cause low backache. Uterine fibroids or something called a pelvic inflammatory disease or inflammation of the pelvis and the genital organs can cause a low backache. So it's not just the spine or the vertebrae that causes low backache. The other factors also will have to be ruled out. Another common cause of low backache is bad posture. Like sitting like this is not really good for your spine. So sitting straight up like this is the healthy way of sitting. So it's called office syndrome. People who spend a lot of time in front of the computer or mobile, they can have low backache. So correcting bad posture, correcting your posture can actually give a lot of relief.